Hi, my name's Laura and welcome to today's Anatomy for Yoga Teachers. Today we are covering my favourite topic, the anatomy of your shoulder. Your shoulder is just the most amazing complex joint that is capable of great strength and flexibility. But you need to know how to use it to get the best out of it. You need to know how to create stability and mobility for optimal pain-free function. If you ask someone to point to the area they consider to be their shoulder, most people are going to come right out here to this outer bit where the head of the arm bone sits in the shoulder. It is so much more than that though, and I tend to like to think of it as the shoulder complex to refer to it being more than just that one area. So how many different bones make up your shoulder complex? So it's 3 bones. Your clavicle, aka your collarbone, your scapula, aka your shoulder blade, and your humerus, aka your upper arm bone. So these are the 3 bones of your shoulder: clavicle, scapula, humerus. So if you have 3 bones in your shoulder, how many joints are there in the shoulder? So you have your glenoid humeral joint. This is the main joint and what most people tend to think about when they're referring or talking about their shoulder joint. It's where your humerus, that upper arm bone, sits in the glenoid fossa, this space here. You also have your AC joint, your acromioclavicular joint. It's not important for you to know that, but it's important for you to know there's more than one joint. So the acromioclavicular is where the clavicular, the collarbone, sits next to the acromion, which is really the beginning of your scapula. And you have the SC joint, sternoclavicular, again the clavicular, the clavicle, the collarbone, coming down to the sternum. So it's where that collarbone is inserting right here, the sternoclavicular joint. You also have a 4th joint, your scapular-thoracic joint. This is really a false joint, but it's worth keeping in mind. It's where your scapula, your shoulder blade, can slide on the back of your ribs in the thoracic area. So we want to look at how to stabilize your shoulder joint. To create stability and integrity in your shoulder, we don't need to worry about stabilizing your collarbone because that rarely moves. But we do need to think about creating stability for your scapula, your shoulder blade, and your humerus, that upper arm bone, because these two really do have a lot of movement. So how do you create stability in the body? Stability in the body comes from your bony structures, so the actual shape of the joint. So for instance, the hip joint, you have that socket that sits tightly over the bone. So the bony structure. You have your joint capsule. You have ligaments that are attaching the bone to bone. And then you have tendons, which are attaching the bone to the muscle, and you have muscles. And all of that comes together to create stability. Now, your shoulder really wasn't intended for much stability. It's intended for large amounts of mobility. So looking first at this main joint that we want to stabilize, the glenoid humeral joint. So this is the glenoid fossa here, and it's this socket that the head of the humerus, the head of my arm bone, sits in. Now, whereas in the hip you get a deep socket that the top of the thigh bone, the femur, can sit nicely into, the glenoid humeral joint is very different. This glenoid fossa is really quite open, more like a very shallow disc that the head of the humerus can move around a lot in. And this has a tendency towards mobility as opposed to stability. You think about all of the movements that your arm can do in space here in this joint area. The joint appears to be almost floating. You can imagine it like a little golf ball sitting on top of a tee, ready to move. Now this said is very different to the ball and socket of your hip joint, which is made for stability, for weight bearing, for loading, so has that snug fit. Shoulders, more biased to mobility. However, In a yoga practice, please ignore that saying that there. However, in a yoga practice, we aren't always using our shoulder for mobility. Some of the time we do actually weight bear on the shoulders. Like this here in the handstand, I'm keeping my shoulders very strong, very stable to absorb the weight of the rest of my body. Now, this isn't what I was initially designed to do. However, our shoulders do have the ability to stabilize. They have great structures that are designed to give support if you choose to be weight bearing on your arms, for instance, in a yoga. But you have to focus on turning these muscles on to stabilize my scapula, my shoulder blade, and my arm bone here. So let's look at the muscles of your shoulder that are there to help stabilize it whilst we're weight bearing in yoga. We want to be stabilizing your shoulder blade, the scapula, and the arm bone, the humerus. So let's first look at the muscles that are stabilizing your scapula, your shoulder blade. So there are two muscles that are doing this, your rhomboids and your serratus anterior. And here's my scapula, my shoulder blade in the middle. And you've got the rhomboids, serratus anterior that work together. I almost think of them to some degree as one to stabilize this. So in your rhomboids have major and minor, but think of them just as one muscle, not covering a very big area, but they do a lot. So your rhomboids are coming from C7, that final cervical vertebra, down to T5, the fifth thoracic vertebra. And they are originating out from this area, and they're inserting at the medial border of your scapula. Now, if you were to contract, so if you were to shorten this, what would happen? If you were to shorten those muscles, what would happen? Your shoulder blades would draw back together. So when you contract your rhomboids, your shoulder blades draw together, and then that's having the action of also opening the chest. So what yoga poses have the action of squeezing the shoulder blades back together, what we actually call retracting the shoulder blades. So there's quite a few poses that you can choose to do it in, but two key examples are here. Cobra pose. Again, you have to choose to do it in cobra. So in cobra pose, I come up, I choose to draw my shoulder blades together, engaging the rhomboids to help me open up the chest. And also in bridge, when you interlace the hands underneath you and walk those shoulders in, again, you are retracting the shoulder blades by contracting your rhomboids, opening up the chest. So what stretches your rhomboids? It's obviously going to be anything that takes them the other way. So simply pressing the ground away from you in cat pose, rounding the back, eagle arms, pressing the elbows away, or even one of the arms in thread the needle. Many other poses do it as well, so it's just a couple of examples. So then let's move on to the other muscle that stabilizes your shoulder blade. And this is your serratus anterior. Now this is a beautiful muscle, but less easy to feel and engage. So serratus anterior actually got its name from the fact it appears serrated, like a serrated bread knife. It appears serrated, or I like to think of it like my fingers coming round here. You can see this lovely example on this model here. And if you find someone that works out a lot, you might be able to see this. I remember having to ask a personal trainer once, please could I see your serratus anterior? Because it wasn't somewhere at the time I could connect with on myself. So it originates right up from the first rib and is coming all the way down to the 8th or 9th rib. It does differ person to person. It's going underneath your shoulder blade. So it's going underneath it. And from there, as it goes underneath, it's also attaching to the medial border of the scapula. So I'm just going to go back a bit actually and let you see this again here. So it's coming from the front of my ribs and it's coming underneath the scapula and joining to the same place, that medial border. This is why you can really think of these muscles almost as one, and they work like a game of tug of war to together hold that scapula in the middle. So let's just jump forwards again. So when you draw these points together, the scapula moves into protraction. Okay? So my shoulder blades move apart. When I engage my rhomboids, my shoulder blades retract and move together. When I engage my serratus anterior and protract, they move apart. It's a very thin sheath of muscles, and it's a proper activation of your serratus anterior can take time. It's not the easiest thing to feel. So in yoga, you might have heard of winging the scapula. So it's not so easy to see here, but it's when in poses the scapula appears to have come away from the back. And in some people, you can really actually get your thumb in the space between their shoulder blade and the back of the ribs. So this is called scapular winging. And you'll often see this in poses like chaturanga and then winging up off the back. So the action of drawing the scapula onto the back, like velcroing them to the back, rather than letting them wing up, is a really important thing to work on. And it is your serratus anterior and your rhomboids that help velcro that shoulder blade tight to your back. So you can explore how these two work together simply by holding something like a block in front of you. Push the block away from you. As I do that, I've contracted serratus anterior, protracted. Arms straight, draw the block back towards you, retracting. But how could you do those two things together? So how could I push away and feel the shoulder blades drawing back and together? So I've got a subtle engagement of both muscles, so like that game of tug of war, holding my shoulder blade tight in place. We'll explore this in movement in a yoga class as well. So to recap, Chaturanga Dandasana is a great example. The rhomboids retract whilst the serratus anterior protracts, and together they're working as a team to stabilize. You need to actively engage these muscles to create this stability. Ideally, you can do this any time that you are weight bearing on your hands. So think crow, downward facing dog, chaturanga, side plank, any of those big poses where you're weight bearing on them. So let's now look at what stabilizes your humerus, your upper arm bone. So if we didn't stabilize this would be too loose, like loosey-goosey, this arm just hanging down. So your humeral stabilizers are to stabilize the glenoid humeral joint. Just a second. Okay. This is a group. What stabilizes the glenoid humeral joint is your rotator cuff. Now, most people have heard of that, the rotator cuff, but aren't actually sure what it is. So let's get very clear on this. Your rotator cuff is 4 muscles. They primarily function together as one cuff, but it is 4 muscles, and we're going to start to look at them from the front of the cuff. So your rotator cuff, as I just said, is 4 muscles that primarily function together. It really isn't important that you know these details or that you remember them, but you need to know where to come back to if, for instance, a student is having a problem with their rotator cuff and asking how to adapt their yoga for it. So we're going to go over it. Don't worry about memorizing it, but know where to come back to this information when you need it. So the 4 muscles, subscapularis, supraspinatus, infraspinatus, and teres minor. Let's start with your subscapularis. Now you're looking here at the front of the body. So if you can see, there is the clavicle, the collarbone. And just imagine I've deleted the ribs away. So you're looking at the front side or the anterior side of your shoulder blade. So not the back, but the front side of my shoulder blade. And this is where subscapularis is. So it's really coming out from right under here, right in this groove, and coming out to that medial border. And it's inserting what's called the lesser tuberosity. So again, you can imagine this like a piece of duct tape, helping to hold everything nice and stable. Contracting this muscle will internally rotate your arm. So these muscles have very, very little movement, but they do a bit. So if you contract subscapularis, it helps you to internally rotate your arm. It's very much about drawing your shoulder down into the socket. So you see a lot of time people's shoulders lift up in yoga poses, and we're trying to sort of up here, we're trying to get that shoulder to draw down into the socket, and that's partly subscapularis, drawing the head of the shoulder down. Anytime you're weight bearing your arms, you want to be strengthening this muscle. Externally rotating will stretch it. Not a huge muscular action, not hugely important for you to remember either. You can attempt to feel it. So if you bring your hand like a little claw, and you're going to take it under, and do this on the dominant side. So I'm right-handed. So I'm going to get my left hand to go under. I'm trying to pinch either side of my scapula. And then you're going to bring your hand to the belly, kind of push your hand to your belly. And you might feel some muscular engagement just popping up in there, but you might not. As I said, it's not a prime muscular action. Moving on, you have your supraspinatus. So this originates from the divot above the bony bit of your scapula. So if you bring your arm over your shoulder, you've got this sort of soft area here. Then if you walk your fingers down, you find the spine of the scapula, that ridge that sticks up. Come just above it and there's a divot. Okay? So if you know the word superior, so this is superior, it's above, supraspinatus. So holding that divot, it's coming out from the edge of the scapula there, coming through this divot. But can you see it's coming under my acromion-clavicular joint? It's coming under there, and it's just coming over the top of the shoulder, where it's then attaching to the head of my humerus, and it's attaching to the greater tuberosity, which is just on the outside here. So it's coming under here, under the bone, and then attaching to the top of my arm bone, helping to hold that all together. Now, when you contract your supraspinatus, when you shorten it, just lifts this up a bit. So if you imagine something on here, as I contract it, it lifts my arm. Now it only does the first sort of 45 degrees of that elevation there, so just a little bit. Again, it's just really helping to hold that arm on to my body. So over here, holding it on. So then looking at your infraspinatus, come from that soft divot, come from supraspinatus, inferior, it's going to be below. Find that spine of your scapula, and then just fall off the top of it. So you're falling down into that divot just beneath it. So this area here is your infraspinatus, so beneath the divot, and it's covering the majority of the back of your scapula. You can see it's covering all this area here, a nice covering, and it's also inserting into your upper arm bone, into the humerus, into a bony protrusion called your greater tuberosity. Whilst weight bearing, it's helping to hold your arm bone in the right orientation in your shoulder, so in the middle of your shoulder. Sometimes you'll see in poses like Chaturanga Dandasana, someone's shoulder coming too far forwards and then leaning into the front of their shoulder. This helps to hold your arm back in the middle of that glenoid fossa, so not falling forwards, so helping to hold it back. Really useful in Chaturanga Dandasana. Also internally and externally rotates the arm. Teres minor is very much doing a same job. okay, is infraspinatus. So you can think of it very much the same. It's coming from this lateral border of the scapula, also attaching, holding on to your arm bone, also in the greater tuberosity. So I want you to recap on what really is important for you to know about the rotator cuff. So the rotator cuff is 4 muscles, so it's not ligaments, it's not tendons, it's muscles. It's 4 muscles which together stabilize your upper arm bone in the socket. They cover the front, top, back, and underside, and that is together why it makes a cuff. They're not prime movers, they are stabilizers of your arm bone in your shoulder. There are some other muscles that are connected to your shoulder area, and we'll have a quick look at them. So you've got latimus dorsi. This is a huge area of the body, and a large amount of the movement for the arm is connected to the latimus dorsi. It covers over 2/3 of the back though, so we're actually going to look at this muscle in more detail when we look at your back. Trapezius. When people get all tight up here and the shoulders hunch up, this is invariably to do with the trapezius. So it's a broad triangular diamond-shaped muscle. It originates from the center of the back, from the very base of the skull, and it's coming into the clavicle, the collarbone, and into the scapula. So there is a lot going on with your trapezius. What I find quite interesting is that it's really got 2 actions going on. So it's to helps me lift my arm up, but it also helps me extend my neck. It has 2 jobs, lifting my arm and extending my neck. So if you think in yoga how often we combine those movements together. So take the sun salutes, inhale, reaching the arms out and up, taking the gaze, the drishti, skywards. So if someone's feeling tight through the trapezius, asking them to do 2 things at the same time might be quite a lot of work for them. So you might find someone that's got shoulder tension, might find it easier to lift their arms and then extend through their neck, rather than always having to do the 2 the same. I know it feels different for me, so you have a go. Reach the arms out and up as you lift the head. I feel a bit tight and constricted in my neck. Or try doing one and then the other. Lift the arms, then lift the neck. I have so much more freedom in my neck when I do that. Try it again. Lift the arms, and then lift the neck. So I think that's a really interesting application of anatomy into our yoga poses there. You also have your deltoids. So your deltoids is a 3-part muscle, anterior, the front, lateral, the side, posterior, the back sections. So originating from your clavicle, your collarbone, from the acromion, and also from the scapula, and it inserts into your arm bone. So it sits like a shoulder pad over the top here, and it helps to move the arm forwards, backwards, up and down. It can be weak and tight in people. You really notice it in something like tabletop. That's where someone feels tight across the front here, might be tightness in their deltoid that's restricting that movement. Then your pectoralis major and minor, the pecs, 2 muscles that lay across the front of the chest. So again, also good to think of these when we think of the shoulder. They're very active in something like chaturanga or a push-up. They originate from the 3rd and 4th and 5th rib and insert into your coracoid processor. That's teres minor that inserts there. And then the pectoralis minor. And then pectoralis major inserts into your humerus, into that arm bone. It's a fairly damn large major muscle. It adducts the arm, so it draws it in and internally rotates, stabilizing in things like chaturanga, and in dandasana, it depresses the arm and the shoulder. So we do use these in yoga Not hugely, but we definitely do use them to some degree. So common injuries that you might see that relate to the shoulder. And you can always research these, learn more about these when they come up. So you have the rotator cuff. You can get rotator cuff tears, impingements, or tendonitis. If someone's coming to you saying they've got a rotator cuff injury, let them tell you about it, and then you can refer to what yoga poses might or might not help. And you can always research. So rotator cuff injuries are more common for people who perform overhead arm movements for a sport or a job. So tennis player, cricket bowlers, archers, swimmers, house painters, decorators, hairdressers, where they were performing repetitive overhead arm movements. It becomes more common with age, and injury to the rotator cuff increases with risk over about the age of 40. Frozen shoulder is something you will definitely come up with at some point. So frozen shoulder is characterized by stiffness and pain in the shoulder joint. Still a lot of learning that people are doing on this. It happens slowly over a period of time. It can be 1 to even 2 years. Symptoms typically begin slowly when someone is beginning to lose range of movement in the shoulder. This is called the freezing stage or the inflammatory stage. Then you get the actual frozen adhesive stage, and the pain can decrease at this time, but movement is much stiffer, range of movement diminishes greatly. Then you get the thawing stage when someone's range of movement is beginning to improve. It's just good to ask someone, where is your range of movement? So if I'm coming into all fours, can you bring your arm level with your shoulder? Can you bring your arm overhead? If they can't do that, you know they can't do downward facing dog, and they're going to be taking all fours. Saying things as like chair pose, only lifting the arm to where it feels comfortable, not forcing that stiff range of movement. Osteoarthritis, that's something we come against quite often. So this is a wear and tear when the smooth cartilage covering the bone wears down over time. There's nothing that we can do to improve that. That cartilage won't grow back. We want to minimize impact, minimize weight bearings. It might be all fours instead of downward facing dog. If someone has got a dislocated shoulder, they're not going to be coming to yoga. What you might see is post, where they have instability or hypermobility in the shoulder. So you want to ask them to do less, to back off, to not work on improving flexibility, but work on improving stability in their shoulder. Now, key points for yoga teachers. When you're teaching yoga, focus on stability in the shoulder when you're weight bearing. If you're not weight bearing, the arms can move as freely as they like. If you're weight bearing, teach stability. Give people permission to take options, all fours instead of downward facing dogs. Palms may be rotating up in warrior two, hands at the heart in chair pose, hands wider apart in something that's overhead, not having to bring the hands together always. Transition in and out of weight-bearing poses slowly. So if you're coming back from cobra to dog, or dog to cobra, or chaturanga to up dog, take those poses slowly, focusing on stability. Teach people about protracting and retracting the shoulder blades. Put poses in that strengthen that action. Strengthen the back of the shoulders. So in cobra, Q, squeezing the shoulder blades together. In that half lift, Ardha Uttanasana, Q, squeezing the shoulder blades together. Teach locust pose, anything that's strengthening the back of the shoulders, the upper back. Be strict in Chaturanga Dandasana. Get people to put their knees down and lower with stability. Once they can do that, then they can lower in that full chaturanga. But you want to be strong and stable and to not rush ahead. Vary your sequencing. Don't always use the dog, plank, chaturanga. Put other sequencing approaches in to avoid repetitive strain. And share anatomy knowledge with them. The best way to learn about the body is to teach it. So decide you're going to teach about the shoulders in yoga today and teach people a little bit of anatomy. They'll love learning it and they can put it into their yoga as well. And thank you so much for doing this with me. I know it's a lot of information. We're going to put it into movement and that will really help what's important settle in, and the rest you can come back to it. When a student comes to you with an injury, that's when it's relevant. That's when you will remember it. Thank you. Namaste.